Hello everyone, welcome to another Upgrade Your OET Vocabulary Quiz by Bose Learning. My name is Sona and I'm going to be your teacher. And my quiz for you today is all about an MOT. Now in these quizzes, I'm looking to give you an insight into the everyday vocabulary that we use and that you may find being used by your own patients in healthcare settings. And because this is an OET special, we're also going to be looking at some useful expressions that you can use in your OET Speaking Sub-Test. I'm an OET premium preparation provider, and what that means is that I've done extra special study to make sure that my courses can be the best that they can possibly be. So if you go onto the OET website and search for preparation providers, you'll be able to find those that have taken the preliminary provider course, which I've also done, and then those like me who've gone on to do further studies and are premium preparation providers. And you'll be able to find me on the list. There I am, on the list of course providers. But back to my questions for you today then. What is an MOT in the normal sense of the expression? What is a health MOT known as? What happens in one? And where do they take place? We'll then go on to look at some useful questions that you can use in your OET Speaking Sub-Test. So first of all, what is an MOT? Well, in the UK, to be able to drive a car legally, you need three things. Of course, you know you need to have a driver's license or a provisional license, and the car itself has to be taxed, and it also has to pass a test, an MOT, a Ministry of Transport test, every year to check that it's roadworthy, to check that it functions as it should. So these things include tyre pressure, tyre tread, the engine, the headlights, everything like that, to make sure that the car itself is roadworthy. Now, this has become such an important part of our culture that we also use it to talk about health and to talk about healthcare checkups in general. So instead of checking the well-being of a car, we're checking the well-being of ourselves, people, to make sure that we are running okay. So a health MOT is also known as an NHS health check. Now, whereas for a checkup, you might just not be feeling well and you go into the doctor for a checkup, or you go and see the nurse maybe and tell them what's troubling you, with an NHS health check, it's something that you're actually called in for. Little word of advice here, I'm not a healthcare professional, so all my information comes from the NHS website, and I'll put the URL here and I'll also put it in the information below. But what is the NHS health check? Well, this is part of preventative medicine. So if you live in the UK and you're aged between 40 and 74 and you haven't had a stroke or any pre-existing health condition, the GP or the pharmacist still want to see you regularly and make sure everything is okay. Of course, because everything is hopefully okay, you don't need to go and see them all the time, but you do get a letter or a text message asking you to come in every 5 years and just make sure that everything is continuing as it should be. But what happens in one? So these health checks take 20 to 30 minutes and they could be conducted by a nurse or a healthcare assistant in your GP's surgery, or they could also be conducted by a pharmacist in a pharmacy. The healthcare professional will ask you some questions about your lifestyle, family history. They'll take your height and weight and your blood pressure and do a blood test as well, either at the appointment itself or maybe before or afterwards. Once you get your blood test results, they'll give you an indication of your chances, your risk factors of getting a heart disease, stroke or kidney disease or diabetes. And also, if you're over 65, They'll also look for signs and symptoms of dementia that they can look for and also that you can be aware of. Now, in terms of useful language and pronunciation, because that's something else I always like to look at when we go through these NHS pages together, I've got two for you here. So, measure, measure, this is the j sound, and here, dementia, dementia. Note this I is missing from our pronunciation. Dementia. Measure, dementia. Okay, so once I've taken all the information from you, they've checked out your blood pressure, your blood results, etc., they'll then give you personalised advice on how to reduce your risk. So things like improving your diet or increasing your physical activity. Perhaps you'll have to take some medicine to lower your blood pressure or cholesterol, or they could give you advice on how to lose weight or stop smoking. Pronunciation-wise here, we have this word cholesterol. 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 And where do they take place? Well, that kind of depends on where you live in the UK, but it could be at your GP surgery or the local pharmacy. Sometimes it could also be at a local library or leisure centre, because we have these mobile units to stop passers-by. So quite often people are really reluctant to go in and see the doctor if everything is okay. But of course, as part of preventative medicine, we want to check that everything is okay. So they grab passers-by, they welcome them in, they say, come in for a free health check today, or they go into places of work and they set up a mobile unit there and try and encourage people to have this Health MOT, this NHS health checkup. Now I have a little question for you. Can you remember what health topics are covered in your appointment? I'm going to give you 30 seconds to try and remember what they are. How did you do? Did you remember? Just before we go through them, I'd like to give you a quick reminder that if you like these videos, please don't forget to click like, share them with a friend or a colleague who you think will like them as well, and subscribe to us. And if you press that little bell icon, you'll also get a notification every time a new quiz or video is put up by us. So how did you go? Did you remember what the topics were? So the topics that are covered in your health check appointment are lifestyle, family history. They will measure your height and weight, take your blood pressure, do a blood test, and then give you personalised advice on improving your diet, increasing physical activity, perhaps taking medication, maybe some information on how to lose weight or stop smoking. As part of your OET sub-test, you may have to ask some of these questions yourself. So first of all, I'm going to give you 30 seconds and try and think of some questions connected to lifestyle that you may need to ask in a general checkup. Your 30 seconds starts now. How did you go? Well, there are quite a few that you could ask, but you could start with something like this. Okay, I just need to ask you a few questions about you in general. if that's okay. Don't forget, it's always polite to check and just make sure that the patient is happy with what you're going to do. And you give them a little pointer about what's going to happen. You're going to be asking some questions about them in general. These questions could include, what do you do? So you're trying to find out about their job. Then you may need to explore things like if their job is very sedentary or if they're lifting heavy things. And then adapt your questions as necessary. Maybe you want to ask, how long have you been doing that? So is maybe someone potentially at risk of repetitive strain syndrome? Maybe. You could also ask, how physically active would you say you are? And maybe follow up with a question like, how many times a week are you active for at least 30 minutes? So that's the ideal, that you are active for at least 30 minutes, you have your heart raised for 30 minutes. And I can't remember how many times you should be doing that, but I think it's at least 3 if I remember correctly. But maybe you can tell me and give me some better advice on that yourselves. As I say, there are more questions about lifestyle that you could ask, including about drink and smoking habits, maybe substance abuse, mental health, lots of different questions, but these are just some. Okay, next up is family history. 30 seconds to think of some questions connected to that. Okay, so again, first of all, signal that you're changing topic. Now let me move on to some questions about your family history. So you've finished taking personal history and now you're moving on to family history. Do or did either of your parents suffer from high blood pressure or cholesterol? Maybe something like, is there a history of breast cancer or diabetes in the family? And then maybe, is there anything else you think I should know about? So maybe they are worried because their aunt had a mental health crisis and they are worried that something similar might happen to them, so they wanted to tell you about it. So you can also ask a nice open question, inviting them to give you any information they think is important. Okay, moving on then. Now remember this next part, measuring height and weight and taking blood pressure and doing blood tests, that's not something you have to do in your OET, but I thought it would be nice just to think of some questions or some introductory phrases for that anyway, for your general knowledge. So 30 seconds to think of some questions or phrases connected to measuring height and weight. So you could say something like, okay, we just need to take your height and weight now. Can you take off your shoes and hop on to the weighing scales there? Now this is a nice friendly expression, hop. We don't literally mean stand on one leg and jump onto the weighing scales, but it just indicates that action of going on to the weighing scales. And it's a friendly way of saying, please can you stand on the weighing scales? And if you could come up and stand nice and tall up against this wall here. So to stand nice and tall means to stand straight, and up is directly against this wall. Okay, and finally, 30 seconds to think about some questions about blood pressure and doing a blood test. Again, not something you need to do for your OET, but just for your general knowledge. Now, I've just got to check your blood pressure, so if you can rest your arm on this cushion here. So quite often you have to rest your arm on something so that the blood pressure can be taken accurately. Quite often we start with a now, just to soften it, and we say just to make it softer and politer. And you've already had your blood sent off, haven't you? So maybe the patient has had their blood test, or if it's something you have to do, and the last thing I need to do is take some blood from you. Can you make a fist for me? So to make a fist is when you bunch your fingers up tightly into a fist shape. Okay, and then some expressions to give useful information. Now, of course, this depends on what's happened before and the information that you need to give. So some general expressions you can start off with are, thank you for going through all that with me. So thank the patient for telling you their history, their family history, etc. And then you give your advice. What I'd suggest is maybe trying to eat more fruit and vegetables. Have you thought about reducing the amount of sugary food you're eating? If you could try doing something that would help reduce your risk of, why don't you try walking around the block every day? And then I could refer you to a smoking clinic if you like. So these are just some ideas for you. Well, I hope you enjoyed that little look at an MOT and a health MOT. For more information about our on-demand courses and to get yourself a discount, have a look at the information box below. Now, these courses are all pre-recorded and I've designed them especially for students looking for an insight into the OET. I've got 2 for doctors and those cover writing and speaking. I have finally got round to publishing the speaking course for nurses. Sorry about the delay with that one, but it's now out and ready to download. And also there's one available for reading and that's suitable for all professions. One more time, don't forget to click like, share and subscribe, and why not watch another quiz right now.